Hello everyone, today I will be taking you through the demo of Odoo OpenERP 8 Healthcare Management System, a product by Pragmatic TechSoft. First, let us go through the configurations of the system. These are lab testing units. In this, we have different type of lab tests. In each lab test, we have various test cases assigned with the related lower limit and upper limit. These work as template for the lab tests. Next, in imaging, we have imaging test type and imaging tests. In diseases, we have around 14,181 diseases pre-configured in the system as per ICD-10 standards. Also, there are around 284 disease categories. Next, in medical procedures, we have around 72,589 medical procedures pre-configured in the system as per ICD-10 standards. In health centers, we have health centers. Then we have health center buildings. We have health center wards. Then there are different type of beds. Within we configure bed type, the status. Next, in the physician record, we have details of the physician and we have the specialty of the physician. In medicaments, we have around 375 medicaments pre-configured in the system. This is medicament dosage frequency, medicament dosage units, forms and categories. In insurances, we maintain the details of the insurance company and insurance of the patients. This is a sample insurance record wherein we have type of insurance, the plan details, name of the insurance company, start date and end date of the insurance. Next, in genetics, we have details of different type of genetic risks. Around 4,298 genetic risks are pre-configured in the system along with the details of the official long form, official symbol, affected chromosomes, etc. In medical specialties, we have around 58 medical specialties pre-configured in the system. We have 653 occupations, around 7 ethnic groups, recreational drugs, and this is a list of pediatric growth chart as per WHO. Now let's move towards a patient's record. This is a sample patient's record. In this, we have details of the patients like address, phone number, fax, email, etc. of the patient. We have details like what is the blood type, what is the ethnic group, insurance detail, etc. In diseases, we have the history of diseases that the patient has suffered so far. In medication, we have details of the medicines that were prescribed to the patient. In appointment, we have the details of the appointments of the patient. Evaluations, we have details of patient evaluation. In genetic risks, we have details of genetic risks. In gyneco information, we have the details of gyneco screening, pap smear history. Next is socioeconomics. In this, we have socio-economical details of the patient. Infrastructure, we have infrastructure details of the patient and family details of the patient. We maintain the APGAR score of the patient as well. In surgeries, we have details of different surgeries that were done on the patient. Then in lifestyle, we have details of the lifestyle of the patient. What is the diet and exercise information, addictions, sexuality and safety details. In lab tests, we have detail of the various lab tests that were performed on the patient. Next, let's move towards the appointment. This is a sample appointment. Let us create a new one. Then confirm the appointment. Prescriptions can be created for this. We can enter the details like the dosage, common dosage, specific dosage of the patient. This is pediatric symptom checklist. So a new pediatric symptom checklist can be maintained for the patient. This is a draft invoice which can be created for the patient. We can edit, enter the information, save, validate, register payment. Now this invoice has direct effect on the balance sheet, thus any transaction you do here will affect the balance sheet accordingly. Next, let's move towards lab test requests. You can request for the lab test. The user can then create the lab test, and in the invoices you can see the details of the lab test requests and create lab invoice. This works in the same way as the appointments invoice. Next, let's move towards the inpatient administration. Suppose a patient has to be admitted in an hospital. You can enter the details like the hospitalization date, expected discharge date, the name of the patient, attending physician, etc. We can also enter the nutrition information, the medication information, and care plan and discharge plan. In the ICU, patient ICU information, the history of mechanical ventilation is maintained. In GCS, that is Glasgow score, we maintain the details of the patient's Glasgow score. We can maintain the ECG information of the patient, and we have Apache 2 score which is generated based on the entries in the columns. We have a family record, different patients of the same family belong in one family record. The family history helps to maintain and it helps to diagnose the health of the patient. Next, in pediatrics, we have details of the newborn. We enter the details like what is the name of the baby, name of the mother, then what is the gender of the baby, the details of length, weight, the neonatal signs and symptoms, neonatal reflex check details of the newborn, and we can maintain the other details as well. Next, we have this surgeries module wherein we can maintain the details of the surgeries of the patient. What was their status when the surgery was done, how long was the surgery, etc. A history of these surgeries is maintained in the patient record. We also have this patient ambulatory care wherein the details of the patient when he enters the hospital is maintained. What is the temperature, heart rate, blood pressure, oxygen saturation level, respiration rate, etc. of the patient. We maintain the details of the procedures and of the medication that was done. Next, let's move towards imaging. An imaging request can be created for the patient by the doctor. So you enter the name of the test, create the request. As you can see, the request is created. This is a draft request. We confirm the request and then you create the result. In result you can create attachments. The attachment can be a URL or a binary file. In this way you can maintain the information of all the imaging tests of a particular patient. Archives record. Archives is basically to manage the instruments that are used in the hospital. So which person was allotted which instrument and whether it is available right now or no, all this information can be seen from the archive. Next we have is domiciliary. These records are created for domiciliary units with all the information, infrastructural information like whether bathrooms are present or not, whether there's an electricity supply, telephone, internet, bedrooms, running water, etc. Then you have the address details, under which municipality the particular address is. Then other details like what is the apartment number, what is the city, country, etc. of the patient. We also have this medical service. In case any of the invoice does not fall under lab request invoice, appointment invoice or prescription, it can be done from here, from the service, medical service. In this we can create a medical service and add the invoice lines, and then using this create invoice button, invoice can be created. Next is reporting part. We have a medicament list report wherein list of all the medicaments is maintained. Then we have appointment evaluation per medical health service. So you enter the start date and end date, and based on that the evaluation of all the invoices within a particular period are shown. You have appointment evaluation per doctor. So if you select the name of the physician and you select the start date, end date, all the invoices for or appointments for that particular period will be seen. Patient evaluation. Now here we have different options to group it by patient. You can group by doctor. You can do it by evaluation date. So you have different options which can be used for patient evaluation form. Then you have appointment evaluation per prescription. You add the start date, end date, and you can name of the physician. You can see the prescription details for that. Then you have appointment search. You select a specialty and then you select the start date, end date. All the appointments for that particular time frame will be displayed. Along with that, we are also provided with the website feature. In this, the user can modify his or her own website, create blogs and events. This is a sample blog created. In this way, we can create many blogs, many pages on the website which can be helpful for the patients. The main events or main information the hospital would like to convey to the people can also be shared on the website. If there are job openings or any other requirements, these can be shared on the website as well. User access, wherein the access can be restricted for different kind of users. Multiple users can log in the system. As you can see, Odoo OpenERP 8 healthcare management system provides a complete solution for the healthcare industry, along with different features like websites, blogs, news publishing, etc. That's all about Odoo OpenERP 8 Healthcare Management System by Pragmatic TechSoft. Thank you for your time. Have a good